Good morning again. I'm very nervous, and my colleague said it's not necessary. It's very nice people. And I have to admit, it's my family. I was working about 20 years in the alcohol business, so-called. As on every level, I was together with a group of patients. I was leading a kind of treatment institution, and then I changed into university and built up a prevention center, prevention department. And the last 10 years, as nearly everywhere, it changed away from alcohol to public health issues. And it's a dangerous way because alcohol plays only a small role again now. We heard about the evidence, what politics could change, and so I propose that we skip that part and go drinking a coffee, because it's absolutely right. Since about 15 years we know that politics makes it, and not the psychologists, the medical or other people. But nevertheless, I have the impression that evaluated and standardized programs, as we did in 10 countries, in European countries, could help a small part of the big problem. So I try to run through the whole project. Yesterday my colleague had the shock. She saw 52 slides. I changed it. I want to explain you what Take Care is. It's a project with a new strategy. The strategy is a kind of multi-level approach. And multi-level approach is not meant in a statistical way, it's meant in a very practical way. We are focusing on youth, and we are working together with families, with parents. We are working together with what's the name? That's the problem, because I'm not English. Retailer, seller from alcohol, and we are working together with key persons. Not many with schools, because that's true, schools are not the best place to make prevention. The goals of the main goals of Take Care is written here: compliance with legislation, motivating young people, and especially training risk competencies of the adolescents. Adolescents is meant 21 to 12. It starts with 12. Binge drinking starts with 12. The main goal are also strengthening the educational skills of the parents and supporting key persons, though they are capable to talk in the community, in a youth center, about the issues. And informing and training retailers in shops, small shops, big shops, that they follow the law first, and to teach them, to learn them how to talk with kids, not to fight with them, to talk. One thing is very important, that we are orientated on that social environment. It's not meant a village or a city, it's a kind of belonging together, a quarter belonging together. Each people are knowing each other as far as possible. The multi-level approach operates only if a kind of positively operating in a clearly living space. We have to know each other, otherwise it doesn't work. We have the first target group, the adolescents, young people 12 to 21, which have been noticed as risky consumers. They get a kind of a training. That training is called ROP training and is based on a concept of an Austrian colleague who is called reflecting approach. Is a kind of a practical training with knowledge and with adventure feeling, that you learn to enjoy risky situations without alcohol. The second group are the parents, and the parents are together in groups. And the clue of the thing is we call them home parties. A mother, a father is inviting her surroundings, 7, 8 other mother or father. Normally there are mothers, not fathers, we know. And they are sitting together and talking about problems with the son, the daughter, how to deal with it. Is there a way, are there possibilities to make it better as before? It's working because we took always stones in the whole project which are evaluated, not invented by us. We took always standardized and evaluated parts and put it together to take care, to make take care. The third group, the key persons, are a kind of persons in a surrounding, in a quartier, in a youth center, which has near contact to youth, to adolescents, to girls, to boys. And they are learning in a short way, unfortunately, motivational interviewing. I know you know it. And it's not so easy, and that's one of the weak points in that project, that we had less money, too less money, and too less time to make it really properly. The key persons, they had the duty to targeting possible members, future members of Take Care, our target group, adolescent. The fourth group, the employees in retail, is clear what is. They got only short interventions, because you can't come in a shop and say, oh, that's very nice, would you be so kind and come with me 2 hours lessons about alcohol and how to deal with it. They would laugh and they would get angry. The Belgium developed a whole range of material with wobblers, with brochures, and a systematic way how to sensibilize that employees to talk in a normal way with adolescents which want to buy alcohol, and how to demand the identity and to explain, my dear boy, no, that's not a good idea, to explain, you're too young, please. The summary of the results at the adolescent level has shown that there is a reduction of the consumption of alcohol at adolescents who drink riskily. That means that part of the project is functioning. That's one part of the ROPI training, that are youth from Italy who are climbing up a mountain, and after it they are discussing about risky behavior. Could I say no if I'm anxious, or is it too dangerous to say anxious because my colleague will laugh about me? and linked then with alcohol issues. It looks really scaring. My Irish colleague did, or the colleague did not climbing, it's not easy. They did something, I think, with boats. Yes. The training on the statistical level was functioning. The promotion of risk competence and reduction of alcohol was well. You can read it. For us was important, they could really handle risky situation also in a pub, for example. Significantly, they dealt better with it after 3 months. We could only measure after 3 months because in a situation with youth, there is always holidays and the school is over, and so you can't take 6 months, what would be a normal way. We had a funny finding. So we had a wrong group, for example, in the whole project. The group which was not risky drinking. They were not drinking at all. And after the training, they were drinking. That was not very funny, but it shows that it's very important to identify the really and good target group. Otherwise, you make harm to a group. The compliance with the whole Take Care project was really high of every target group. You see, 94% were completing the training. That's really high. The home parties were a problem because in several countries of Europe it is not usable to invite strange people in the own flat. So they took another way. They went in a pub, in a room beneath the pub, or in a church or whatever. But they always find a way to reach the target which was in head. The key persons was the most difficult group because obviously they are not interested to sell less alcohol, and it's understandable. But the way the colleagues did how they talk with the key persons, and also only 5 minutes maybe, it was often sufficient to make a change. They had the impression they can deal better with risky situations and critical situations with adolescent, and that was the target. Second, we had long and short interventions because only short interventions are possible when you have alone a shop. If you are, for example, a migrant person and you can't speak English or whatever, you have to make pictures and signs and to make it clearly. Nothing new. The results overall. The project improved the competence to deal with problems around alcohol. They improved the competence to deal with alcohol consuming adolescents. they know more, they had a changed attitude, and they had a changed behavior. They drank less as before, the parents, not only the kids. And it was also an aim. They were more readiness to comply with the legal norms. And it's clear the satisfaction with such big projects are always satisfaction, because it's a side effect, because it's interesting, it's new. We don't know when we do it again and again and again, the effect will take going down. You know it. We had some difficulties. We had, because of the European economic situation, a third of the budget we had first. That meant we had to pay many hundreds of thousands of euros by ourselves. The country had to take money, and also we as evaluation center, we had to work free without money. The summary of the statistical numbers would show everything has function. If you look nearer to it, the effects are in many cases not significant. And in the cases, for example, the level of the risky drinkers went down. It was significant, but not very strong effect. That means that project is working, but it needs more. We cannot say now we have found the egg of, not Columbus, that famous egg. So we have to do much more work on it. But it's worth, because that multi-level approach is new this way, and it's worth to testing again. Also on a smaller place, but it's important to evaluate it again. Not only to do too many projects of that kind, or kind of doing and not testing the effects. I give it to you. It's free. You can order it in Germany, and maybe you can write it in a protocol or something. It's also a manual you can get, and other leaflets if somebody wants to make it by yourself. Thank you for your patience.